Good evening, guys. I have discussion E for you. It's a bonus one for y'all. It's discussing a British critical nurse who does hospice for Britain. She shares her insights on key insights about dying that people need to understand. So I'm gonna go over those for you tonight for discussion E. Give me a minute to put my gear back on and get ready for the show, and I'll be right with you, please. Thanks. Okay. Like I said, this is from a British critical nurse who does end of life in Britain. So we're going to discuss that for tonight, for tonight's bonus E. Okay, summary of the article featuring insights from Lucy Dowland, a critical nurse manager at UK's leading end of life care charity, Marie Curie's. Okay, that is a center over in UK that people can go to for like end of life care. So we're going to discuss that tonight for E. So please join me in tonight's discussion E. Insights about dying. Key insights about dying. So, the first one is social silence around death. 59%, 58% of Brits avoid discussing death, finding it more taboo than money, religion, or politics. Understanding what to expect can ease emotional stress and reduce fear of the unknown. Okay, then we've got death rattle. Gurging noise caused by mucus in the airways during the final hours. Although unsettling, it's not painful and usually occurs when patients are unconscious. Terminal surge, a surprising burst of energy before death, where patients may temporarily seem better, eating, talking, laughing, often misinterpreted as recovery, but usually precedes death within days or hours. Terminal aggression. Some patients become restless and emotionally unsettled in the final weeks. Symptoms include trouble relaxing, frequent movements, and attempts to leave bed. Societal implications. This piece gently opens a door to normalizing end of life discussions. Valuable not only for caregivers but also for fostering emotional preparedness, and compassionate care. Would you like to dig deeper into how these phenomenon influence memory-friendly care strategies? That seems right in your wheelhouse. It's important to talk about death openly because doing so helps us live and care more intentionally. Here are a few key reasons why. Emotional preparedness. Reduces fear and mystery around dying by what often uh, normalizing what's often misunderstood. Strengthens resilience for patients and families by providing clarity on what to expect. Informed decision making supports shared decision making frameworks, allowing individuals to articulate their wishes and values, empowers caregivers and clinicians to offer care that aligns with personal goals, including comfort and dignity. Cultural and societal shifts challenges taboos and challenges taboos that isolate people in grief or silence. Critical conversations. Encourages public dialogue, which can lead to more compassionate policy and community support systems. Relationship integrity creates space for recollection, gratitude, and closure, ensuring that final interactions, enhancing final interactions with folks. Helps caregivers emotionally prepare while preserving authentic connection. For someone like you, deeply committed to memory friendly environments, frailty aware care, and ethical caregiving, this kind of this kind of openness is foundational. It influences everything from housing design to smart technology integration by ensuring that innovations reflect human priorities. Would you like to explore how different cultures approach death, or how this transparency intersects with aging in place strategies? Different cultures approach death with strikingly diverse rituals, philosophies, and openness, each shaped by history, each shaped by history, spirituality, and social norms. Um, Here's a glimpse into how some cultures foster open dialogue around dying. Japan is acceptance through ritual. Impermanence, encouraging reflection on death as a natural part of life. Uh, a Bon festival honors ancestors with lanterns and dances, creating communal spaces for remembrance. Okay, conversations about death are often uh, indirect but deeply spiritual, woven into uh, seasonal rituals and family cultures or family customs. Mexico celebration and connection. De Dia, Dia dos Los Mentos, Day of the Dead, transforms mourning into celebration with altars, uh, marigolds, and sugar skulls. Families openly share stories of the deceased, reinforcing emotional bonds and continuity across generations. Ganawa, public mourning and legacy. Funerals are funerals are large, vibrant events, sometimes lasting days, with music, dancing, and storytelling. Death is discussed openly as a communal experience with emphasis on legacy and social impact. Tibet, spiritual transition. Sky burials reflect Buddhist beliefs in the cycle of rebirth and detachment from the physical body. Death is seen as a spiritual passage, and discussions often center on preparing the soul for its next journey. India, karma and liberation. Hinduism frames death as a step toward uh, moeska, liberation from rebirth. Opens conversations occurring during rituals like Antyesti, last rites, which guide the soul's transition and honor uh, familiar, familiar duties, family duties, Western shifts. from silence to dialogue. Historically more reserved, Western cultures are now embracing death cafes, hospice storytelling, and end of life planning. Moments like death positivity encourage candid conversations to reduce fear and improve care. For someone like you who's exploring memory friendly environments and ethical caregiving, these cultural lenses offer rich insights. They show how openness around death can shape housing design, caregiver training, and even smart tech integration. Want to explore how these traditions influence aging in place or end of life autonomy? Cultural practices around death don't just shape how we mourn, they deeply inform how we care. For caregiving, especially in frailty aware and memory friendly environments like those you champion. They offer practical and philosophical guidance. Here's how: values driven care. Cultural norms clarify end of life values, making it easier for caregivers to align interventions with patients' wishes. For instance, India emphasis on mollusca encourages care that supports spiritual peace over aggressive treatment. Open communication models, practices like Mexico's Day de los Muertos fosters open storytelling, which strengthens emotional bonds between patients, families, and caregivers. This can reduce caregiver burnout and build trust by humanizing the experience of dying. Emotional regulation and mindfulness. Tibetan rituals focus on detachment and preparation, inspiring mindfulness based approaches in palliative care. These philosophies reinforce caregiver uh, presence, reducing anxiety, and enhancing holistic support. Community integration. Ghana's communal funerals highlight caregiving as a social responsibility, encouraging neighborhood and faith-based. Hold on. 1 second, guys. Networks to actively support the dying. Design influence. In Japan, seasonal rituals and nature centered symbolism suggests environmental cues that could influence memory-friendly housing like spiritual orientation, lighting, and familiarity, cultural competency, and exclusivity. Understanding diverse traditions helps caregivers avoid cultural insensitivity and tailor support for multicultural populations. It informs training programs that integrate narrative medicine, spiritual assessments, and culturally grounded communication. Someone like you who's designing systems for nonsense and purpose. These practices aren't just heritage, they're clinical blueprints and ethical prompts. Would you like to explore how culturally responsive caregiving could be encoded into smart housing or predictive tech for elder care? Cultural practices around death don't just shape how we mourn, they deeply inform how we care for caregiving, especially in frailty aware and memory friendly environments like those you've explored. Championed, they offer practical and philosophical guidance. Here's how. Values-driven care. Cultural norms clarify end-of-life values, making it easier for caregivers to align interventions with patient wishes. For instance, India emphasizes on mollusca, encourages care that supports spiritual peace over aggressive treatments. Open communication models. Practices like Mexico's Dia de los Mentos fosters open storytelling, which strengthens emotional bonds between patients, families, and caregivers. This can reduce caregiver burnout and build trust by humanizing the experience of dying. Okay. Let me get this other page, guys. Give me 2 seconds. This can be translated into scalable, culturally embedded models for aging in place. Design influence. In Japan, seasonal rituals and nature-centered symbolism suggest environmental cues that could influence memory friendly housing like spiritual orientation, lighting, and familiarity. Understanding diverse traditions helps caregivers avoid cultural insensitivity and tailor support for multicultural populations. It informs training programs that integrates narrative medicine, spiritual assessments, and cultural grounded communication. For someone like you who's designing systems with nonsense and purpose, these practices aren't just heritage, they're clinical blueprints and ethical prompts. Would you like to explore how culturally responsive caregiving could be encoded into smart housing or predictive tech for elder care? Absolutely. Interactive learning methods are especially powerful in caregiving training because they shift the focus from passive uh, uh, absorption to active engagement, which aligns beautifully with your emphasis on empathy, systems thinking, and tailored care. Here's a deeper look. Last couple pages, guys. Simulation-based learning, real-world scenarios, mimic caregiving challenges like managing terminal aggression or navigating ethical dilemmas. Trainees make decisions in safe environments, building confidence and critical thinking. Example, a caregiver might role play responding to a patient's terminal surge, balancing emotional support with clinical awareness. Gamification. Gamification adds game like elements such as points, bridges, and leaderboards to motivate learners. Encouraging uh, completion and retention through process thinking and rewards. Example A, model on memory friendly housing might include a change to design space that meets cognitive accessibility standards. Peer-to-peer learning facilitates group discussions, storytelling, and shared reflections. Builds emotional intelligence and cultural sensitivity by exposing leaders to diverse perspectives. Example, caregivers from different backgrounds share how their communities approach end of life rituals, enriching cultural competency. Tech enhanced micro learning. Okay, guys. Those are tonight's shows for now. For now, Gator Wellness. Take care, folks. Have a good evening. I'll see you guys later for show for one more or tomorrow for shows. Depending on how I feel, I'll be back on or tomorrow. For now, Gator Wellness. Take care, folks.